Welcome to this overview of the GP Induction and Refresher Scheme for England and Wales, also known as the I&R scheme. So who does this scheme apply to? It applies to anyone who's previously been working as a qualified GP in the NHS, but not worked as a GP in the UK within the last 2 years. That could be because you were working abroad, you were off sick, working in a non-GP role, or any other reason. It also is a way to be inducted into the NHS for GPs trained in the EU or GPs trained overseas with CEGPR. Now the whole process is managed centrally via the National GP Recruitment Office, also known as the GPNRO, and you can find more details and apply via this website. Once the GPNRO receives your application, it will be assessed, and in some cases you may be recommended for inclusion directly onto the performers list after being assessed by a medical director of an area team, and this would allow you to start work fairly quickly. In most cases, you're going to be allocated to a specific area for assessment, and as part of that there will be an interview having had a look at your paperwork. Once this has been looked at, if you are felt suitable, you'll be directed to sit an initial assessment, which has got 2 papers. There's a clinical paper, which is 86 questions in 65 minutes, and a situational judgment test paper, 50 questions in 100 minutes. This is also known as a professional dilemma paper. Now, for the clinical paper, it covers a broad range of topics at the level of knowledge expected of a doctor who's in foundation year 2. So it covers things like medicine, surgery, endocrinology, ENT, pediatrics, women's health, sexual health, all of the kinds of things that would be expected of a GP. The situational judgment test paper consists of 50 situational judgment test questions, and this type of paper is not testing knowledge per se, although it is useful to have a good working knowledge of biomedical ethics, of the GMC's good medical practice and other core ethical guidance. It's primarily testing your ability to consider and make good judgments in a work-based scenario. So it looks at things like professional integrity, empathy and sensitivity, being able to cope with pressure and professionalism, and these kinds of areas. Based on the results of the initial assessment, you'll be put into one of 5 bands. So a band 1 or a band 2 is a failing band. If you're in either of these bands, then what will happen is that you will be asked to resit the exam after maybe some time to look at how to improve, and you're allowed a maximum of 4 attempts. So either band 1 or 2, resit the initial assessment. If you get a band 3 or a band 4, those are, if you like, passing grades for the initial assessment, and this will allow you to go on to the next part of the assessment, which consists of a simulated surgery. So here you will see 11 simulated patients and be assessed on communication and consultation skills in a simulated surgery environment in the RCGP's headquarters in London. If you successfully pass that, then you'll be allowed to progress based on your score onto the supervised practice part of the induction and refresher scheme. So you'll be placed in a practice. Band 3 usually will be up to 6 months. A band 4, a shortened scheme, up to 3 months. If you were to score band 5, you can bypass the simulated surgery and go straight through to the supervised practice, and this will be for a very shortened period, usually just a couple of weeks, to give you familiarity with the NHS. Now, during the supervised practice, for those doing longer than 2 weeks, you'll be paid a salary of £2,300 per month for full-time equivalent. Full-time is 9 sessions or 37.5 hours, and that's for up to that 6-month period. And once you complete this, subject to successful work-based assessment, you'll be then allowed to join the performers list and start practice anywhere that you like. Now, how can eMedica help? Well, eMedica has been helping doctors prepare for the induction refresher scheme, both for the initial assessment. We have an online service with over 2,000 questions covering the clinical and situational judgment test papers. Also, we run courses to help people familiarize themselves and get individual practice and feedback on their consultation and communication skills. You can find details about all of our courses and services at our website given here.